With that being said, we'll pass on this information to you also. Patient safety is of the utmost concern for TGMC physicians and staff, but there are certain ways that you as a patient can decrease your own risk. This week is Patient Safety Awareness Week, and TGMC is arming you with tips to increase your awareness and safety. And we are very fortunate to have here at the desk with us tonight, to my immediate left, Beverly Moulter-Sundock, who is the Director of Strategic Business and Quality over at TGMC, and to her left, Sid Hutchinson, who is the VP of Ancillary Services there. And I guess we started off first, Beverly, with the question, what does patient safety mean?
Well, the patient safety movement started in 1999 with the Institute of Medicine release of To Err is Human. And then it picked up with another white paper by the IOM in 2001 called Crossing the Quality Chasm. And patient safety are the beliefs, the norms, the environment where patient care is provided in a safe, error-free environment. And it's where patient safety is also the top priority. And the patient safety initiative is to eliminate any error or probability or possibility of error.
Very good. What are some of those things that patients can do to protect themselves, Sid? Some of those things that we may even take for granted that they can do while they're obviously in the hospital to protect themselves.
Yes, over the past 4 years, Terrebonne General has been recognized nationally in the top 5% of providing excellence in patient safety. However, this week we're celebrating Patient Safety Awareness Week. That was started back in 1997 by the National Safety Patient Foundation. That was a result of trying to provide education and awareness of the importance of communication. And probably tonight that's one of the most important takeaways of our discussion is communication between the patient and the healthcare provider.
Very good. Can you explain about patient empowerment, you know, from the perspective of the patient and the healthcare provider, their role? Talk about the empowerment of the patient.
Patients should feel fully empowered, basically, with their health care. In the past, they felt maybe more like they were a participant versus an actual stakeholder or a participant in health care. Today, it's much more important that patients become involved, informed, educated, and invested in their own health care.
Very good. Hypothetically, if I'm a patient, what should I be looking out for, Beverly? What is my role in this situation?
Well, you have, as a person, as the patient, the priority there. You're the 50% stakeholder in your own patient health and awareness and patient safety. Healthy food choices. I know that exercise, resolve your stress, get enough sleep, moderate alcohol consumption, refrain from smoking. Very, very important. These are things that are items that are within your realm, within your ability to control.
Very good. We're going to take a commercial break. When we come back, there are a few other things we want to talk about as a patient in a hospital. Some things we may take for granted from time to time. Again, it is Patient Safety Awareness Week this week, and we want to make sure that you as a patient at one time or another in a hospital might be aware of some of these things. We're going to take a commercial break. We'll return with Sid Hutchinson and Beverly Moulter-Sundock after this break.
My PhD is in chemistry, so I've spent a lot of time doing research in the lab.
I work for Albemarle Corporation. My name is Arcelio Malcolm, and I was treated for prostate cancer at Mary Bird Perkins. I went to Houston for a second opinion, and they recommended the same treatment plan, so I chose to be near my family and have the treatment done here. When you research the technology and the doctors, you see that Mary Bird Perkins is a perfect choice.
Mary Bird Perkins Cancer Center at TGMC.
with the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
Welcome back to the program. We are very fortunate to have at the desk with us Sid Hutchinson, who is the VP of Ancillary Services over at TGMC, along with Beverly Moulter-Sundag, Director of Strategic Business and Quality. We're talking about some of the responsibility of the person as the patient, and Beverly was telling us a little bit about that. We had that slide up. Jason, if you could get that slide back up, we'll look at a couple of more responsibilities that a patient should take care of themselves and do these things when they're in the hospital.
Absolutely. Another patient responsibility is to be respectful to the provider. Of course, as a patient, you deserve the respect, but that provider deserves the respect also.
Right.
Something that's very, very important is compliance to whatever the patient's or the patient regime has decided on between you and your physician. Comply with your medications, comply with whatever treatments are necessary, whatever behaviors. Be prepared. Carry a list with you of all of your not only prescription medications, the doses, the routes, the reasons, the frequencies, but also the non-prescription over-the-counter medications, including vitamins. Avoid putting others at risk. This is really very, very important. Wash your hands frequently. Cough or sneeze into either your arm or some sort of a Kleenex or tissue. And do not please expose others knowing that you have either the flu or a cold, you're running a fever, you've been diagnosed with something contagious.
Very good, very good. When we're in the hospital, obviously we don't want to spread anything or get any sicker than we are. Can you tell us maybe, Sid, some ways to prevent getting sick when we're there?
One of the most important things, as Beverly mentioned, is hand washing. The Centers for Disease Control has identified that is probably the one most important thing both healthcare providers and patients can do to prevent the spread of disease. And no one should feel embarrassed about asking a healthcare provider to wash their hands if you hadn't seen them do that, especially if they're going to do an exam, a physical exam or treatment on you. We recently had a family member in the hospital also, and we were very cognizant of that. And the healthcare providers were very, very receptive to us asking to wash their hands, and actually acknowledged and we're glad we were asking that it was on top of mind awareness for us. So patients in the hospital, that's probably the one most thing they can do is ask the healthcare providers to wash hands if you hadn't seen them do that. And we remind our staff constantly about that, and we do surveillance through our infection control program to assure that staff is washing hands.
So it's our way as a patient to kind of double check and make sure things are going on and I hate, not a pun, but lend a hand to the person who's doing that. If we see something, we have the right to speak up and say. Actually,
a regulatory agency called Joint Commission has promoted a program called Speak Up, where patients should ask and are expected to ask questions. It's their rights and their responsibilities to ask patients to be aware, to be informed, and be part of the healthcare team.
Very good. Beverly, germs and bacteria, it's a little bit everywhere. Tell us those places where we can most come into contact with germs and bacteria.
It is your hands. Oh, it's so scary when you realize that between your fingertips and your elbows, you carry between 2 and 10 million bacteria. And so That is just absolutely incredible. After you use the bathroom, after you use the toilet, the amount of germs doubles. So when
Washing
mommy
is
says wash your hands when you were little, then that really is a good habit to have gotten into. Germs can stay alive on your hands for up to at least 3 hours. So you want to make sure that you're constantly using product. The waterless hand sanitizers are just the most incredible invention. Also, millions and millions of germs hide under rings, under watches, under jewelry, bracelets. So let's make sure that you also sanitize under those items. And damp hands can spread 1,000 times more germs than dry hands. So you want to make sure that you dry. If you're using hand sanitizer, you keep on rubbing your hands together until it's totally dry. If you do an actual wash with soap and water, that you use the tissue to dry your hands completely.
Very informative. Sid, if we want to find out more, obviously we had, a little over 10 minutes to talk about this here, but if a person wants to find out more about patient safety when they're maybe going into the hospital to have a procedure done, where can they go to?
Probably the most easiest way to do it is just Google patient safety. There's a wealth of information out there on things patients can do to take charge, be their owner of their own health care. Two of the more popular websites are the National Patient Safety Foundation, npsf.org, and another place is patientsafety.gov that they can go to. But again, you can Google it and find a tremendous amount of information relative to patient safety.
Very good. So a patient shouldn't assume anything. Go out and look at, make sure that you know what's going on when you go into the hospital.
Absolutely.
Again, they shouldn't be a passive participant in their own health care. We're all paying more for health care now. It's very important. And patients should take charge and be an owner of what's going on in their health care.
Very good. Thank you guys so much for coming on and sharing that with us. Again, it is Patient Safety Awareness Week, and some great information, especially for those of you who maybe in the near future may be going in for some type of procedure or something. And again, we thank you, Sid Hutchinson and Beverly Moulter-Sundog, both from TGMC. Got to take a break. When we come back, we'll have cooking in the kitchen with Canadas, and we'll also give you that parade set up. Of course, we go out and tape all the parades. We're going to let you know when the parades are airing on HTV. We'll do that a little later after the cooking segment. Stay tuned for the cooking segment. We'll be back with sports after that. Take care, everybody.